Meeting doctor here. Wanted to talk a little bit about debriefs in healthcare. So you're starting to see a pattern here. When thinking about military, thinking about aviation, in healthcare, debriefs are used after regular activities such as a surgical procedure, unfortunately, a patient death, a fall that a patient might experience. Um, Simulations in education of medical professionals, so they debrief after various activities, both the adverse activities as well as good things that happen at while providing care for patients. And the purpose is still the same. The purpose is to learn from what was done. If the simulation went really well, then you need to learn what went really well and why. And so that way, when it's not just a simulation, but a real thing happening, then you can respond in the same way or a similar way, right? If we're talking about a surgical procedure, they often have a pre-brief and say, okay, here's what we're going to do, right? Here's what we think is going to happen. And then they have a debrief where they see if things went the way that they thought they would. And sometimes in surgery, things don't go the way that they anticipate. Sometimes once they get into the process, they may discover things that need to adjust. Same thing happens with any event. We discover things as we do things, and as we do those things, we learn, and then hopefully we're doing these debriefs so we can have that learning experience so we can do the right thing in the future. And in healthcare, the right thing is, usually resulting in improved patient safety, improved efficiencies and effectiveness, hopefully reducing overall costs in terms of time, money, and resources for the patient and for the healthcare providers. So that way more people can receive the services that they need and can be done in a way that is safe and good for everyone. So debriefs in healthcare have been around for a very long time. Not quite as long as in the military, but long enough that it's become a standard practice in nearly every healthcare domain, from nurses to doctors to specialists in many different areas. That's it for today. I'll see you next time.